Alrighty, so now we're going to move into ultrasound. Ultrasound and ultrasonic are synonymous terms referring to frequency that is above the range of sound audible to the human ear. This equipment uses non invasive sound waves to create a result oriented treatment. Ultrasonic or ultrasound equipment is based on high frequency mechanical oscillations produced by a metal spatula like tool. So I'm going to start my video and show that tool. So when it's actually functioning, this tool is vibrating or oscillating to create the desired effect. Ultrasound or ultrasonic technology in aesthetics can be used for product penetration and for cellulite reduction. The vibrations created through a water medium, so you want to use a water medium, you want to use a product with this, unlike LED where your skin is clean and dry. With ultrasonic, you are going to use a water-based medium, and that will help cleanse and exfoliate the skin by removing dead skin cells through the oscillation, so through the movement, through the vibration. Did not know it helped with cellulite, right? It's crazy what you can do. You can treat a lot. So if you're interested in body treatments, adding ultrasound or ultrasonic would actually be very beneficial for you. Ultrasound penetrates deeply. It stimulates tissues, increases blood flow, and promotes oxygenation. Oh my gosh. Okay. I'm going to take a minute. Oxygenation. Thank you. Keep in mind that the lower the frequency, the greater the penetration. Conversely, a higher frequency has less penetration. Cellulite is affected through the heat manipulation of the tissue and lymphatic movements performed with the device. Heat is created, and the vibration in the cells stimulate circulation, metabolism, and lymph drainage. The heat damage from ultrasound and other modalities, such as lasers, is what stimulates collagen production. Ultrasound also sends waves through the skin to assist in product penetration. This process is called saponophoresis, which is similar to iontophoresis. So saponophoresis is the waves vibrating in the skin, allowing product to penetrate deeper. That process, saponophoresis, which is similar to iontophoresis. Iontophoresis uses electrically charged ions, so an electrical charge is needed from the electrodes. Some aesthetics ultrasound equipment is rated as an FDA Class II device and may not be used within the esthetician's scope of practice outside of a medical facility. So when you're using the advanced devices or the big machines, you're going to work with a physician in a medical spa environment. Advanced training and technical research on equipment claims are necessary before using any advanced aesthetic machine. Different frequencies of ultrasound are used for medical imaging, physical therapy, and pain management. Lower frequency ultrasonic devices are used for toothbrushes and jewelry cleaners, and handheld devices for consumers' personal skincare that are used at home are milder, but should be used in moderation to avoid damaging the skin. Because of its gentle, non-abrasive nature, this treatment can be a viable choice for clients with sensitive skin, clients with rosacea versus other exfoliating services. So if you have a client who has recently exfoliated or are very sensitive to exfoliators, in the exfoliation step, you can replace it with an ultrasound device. As gentle as ultrasonic therapy is, some clients are still not good candidates, and we'll talk about the contraindications and the precautions. So ultrasound contraindications include open and unidentified skin lesions, any clients with heart conditions or pacemakers or any electrical implants, epilepsy, pregnancy, advanced diabetes, cancerous lesions, or anyone currently under a doctor's care for a condition that may be contraindicated, like all machines. Just like all machines, overuse can be damaging. This is not something that the client should be using at home. They really should be getting this as an upgrade to a facial treatment. So once you introduce ultrasound or ultrasonic therapy, you're performing an advanced treatment and it is there to help simulate product penetration, vibrate the skin to help raise the metabolism of the skin, and help with lymphatic drainage. When used in a body treatment, it could also help with cellulite. Best practices and safety consideration: to avoid excess heat buildup and unstable cavitation, it's important to maintain constant movement of the handpiece on moist skin. So moist skin always. You should never run this across dry skin, and caution should be exercised with fragile and thin skin in delicate areas such as or around the eye. So when you're doing the ultrasound device, whether you're using a ultrasonic cavitation device for body contouring or you're using a handheld skin scrubber with ultrasound, you want to avoid the eye area. I like to go about to the top of the cheek, right under where it begins to fold in, and then I don't go under the eyebrow. So I avoid the eye area completely all the way through. Machines should be maintained in accordance with the manufacturer's instructions, and the machine should be disinfected after each use. So before we do the step-by-step, I'm going to show you how you should clean this device. When using the ultrasonic device, it's important that no water or product gets into the device itself. If water or product were to penetrate in the device, it will stop working, and you don't want to risk your machine. So when you're working with an ultrasonic skin scrubber or skin spatula, I like to take a 4x4, which I don't have with me, a clean 4x4. When I'm using it on the skin, whether up or down, when I'm using it on the skin, I take that 4x4, and after each pass, it's not on, so that's why I'm using it on my skin. I like to take it and wipe that head. I like to keep it face down and wipe, face down and wipe. When I'm cleaning it, I'm going to use soap and water on my hand, clean it, EPA on a paper towel, clean it, rinse it with the paper towel, dry it, and put it away. So you want to make sure that no liquid is actually getting into the housing of this device. And again, I like to keep a 4x4 with me so that when I swipe up and the product folds onto the spatula, I can just wipe it right off before it gets anywhere near that bottom. Does anybody have any questions on how to actually clean it before I move on to the step-by-step? Okay. With this device, each brand of the device is going to be a little different. So you want to make sure that you have the instructions with you to make sure that you're actually functioning the way it should be, depending on what modality you're using. This device is called a Glago device, and it has a cleaning mode, a lifting mode, an ion plus mode, and an ion negative mode. So remember, I said, just like it's very similar to the iontophoresis process, the saponification process is using vibration as well as the ions to actually push that product in. So with this, you want to make sure that you're using negative when needed and positive when needed. No worries, Brittany. Thank you. So I pulled up the manual for this particular device. This is the device we have. The product is designed based on the principles of skin cleaning via ultrasonic high frequency vibration. Ultrasonic wave is a high frequency mechanical vibration wave, which has found wide applications in the field of medical care and beauty. The mechanical wave is capable of mechanically heating and catalytic functions, which is the ion plus and the ion negative. And the mechanical wave is capable, which can generate a soft vibration effect on the skin via the joint effect of low energy and high frequency vibration. The strong molecular frictions, which are 24,000 times every second, that's how much it's moving, can pulverize the water drops. If you turn this on, I'm going to turn my camera on again. Okay, if you turn this on, I have a drop of water on the device. I'm going to change the function. gonna take in place. Again, when I'm working with this device, I've got a clean 4x4. Do's and don'ts. Okay, so do's and don'ts. Only use moist skin. The skin cannot be dry at all. If you're performing this on dry skin, you're going to damage the client's skin and create irritation. It needs to be with a water soluble product, and it needs to be moist at all times. If the skin dries up, add a little more of whatever product you're using and go from there. You want to make sure that you're not overusing the product because it is heating the area. So if in doubt, I would perform the functions for no more than 30 to 60 seconds in an area, but I would do 2 to 3 passes across the whole face. So instead of working on one area at a time, I'm going to work the entire face, and then I'm going to do 2 or 3 passes depending on what it is that I'm using it for. Most of the skin scrubber devices come with silicone covers, and you use the brush side for deep cleansing while in cleansing mode. And that's going to help foam up your products when you have a foaming type cleanser, but it'll also help, the vibration will help the cleanser actually cleanse the skin a lot easier. So that's the brush side. And then there's a wavy side for lifting. So when you're using an essential oil, which you would be using a blend or an essence of some type, you are going to use the lifting mode and the wavy side of the silicone cover so that the skin can be toned and tightened. So you are using lifting with the wavy side if you're using the silicone pad. So if you're using the silicone covers, brush side is for deep cleansing on cleaning mode, wavy side is for lifting with an essence toner serum, and that should be the function that you're using it with. A few precautions: it must remain in a wet status, but make sure that it's not going into the housing. Don't keep the instrument in one area, but slowly move it. Should not stay in the same area. 1 to 2 passes. I like to use it in a way that it's like a map. I'm mapping the face and I'm not overlapping it. Please hold the metal ion bar on 2 sides under the ion plus or the ion minus mode so that the import and export of ions can actually happen. So I'm going to turn my camera on again and show you the 2 sides, because that's where you want to hold the device. You don't want to actually just hold it anywhere. There are particular places that you can actually hold so the ions will actually cycle through. If you are contraindicated to get this, you're contraindicated to give it, because you have to make contact with this if you're using the ion plus or the ion minus. You can use it for cleaning and lifting, but the minute you go into the ion, if you're contraindicated for it, pregnant, lactating, cancer, autoimmune, epilepsy, seizures, then you can't give this on ion or plus or minus. This is a little more information that's specific to the device itself. And then let's look at the actual steps. So you have 4 functions: cleaning, lifting, ion plus, and ion minus. So for the cleaning mode, the steps are fairly simple. Clean the skin with a facial cleanser, and after that, use a facial steamer or a hot towel to open the follicle. I just want to caveat, you're not opening the follicle. Essentially what you're doing when you're heating the area is you are allowing that skin to expand, but not technically expand, more so soften, to help the channel actually allow product to penetrate out much easier. So open the follicle is what's commonly used, but essentially you're really just warming and stimulating the area for better product penetration. So you're going to clean the skin with a facial cleanser, use a steamer if necessary, or a hot towel. And then you're going to choose the cleaning mode with the spatula downward close to the skin with a 45-degree angle. So the spatula has a little turn to it. The hook is going to be facing the skin. So it's going to be a 45-degree angle like shown, facing the skin. So when you're in cleaning mode, if you're using the silicone pad, you're using the brush version, and you have the spatula actually pointed towards the skin at a 45-degree angle, and you're going to use this 2 to 3 times a week if you're recommended for client use. If you are recommending this for in your treatment room, 3 to 5 minutes, and you can also use this during cleansing and extraction. So if you want to use the cleaning mode to extract with, you can do that as well. But 3 to 5 minutes once a week once in a treatment. If a client insists on using this at home, no more than 2 to 3 times a week. They shouldn't be exfoliating and extracting and using the ultrasonic. It should be one of the 3. You then have a lifting mode, which is going to use a facial cream or a anti-aging essence. So a serum, facial cream, toners are good in lifting mode. You are going to choose the lifting mode, and then the spatula is going to be upwards close to the skin with a 45-degree angle as well. So see how you are using the bottom of the spatula is actually facing the client's skin with the cleaning mode. So if the spatula is up, the bottom part is facing to the client's skin with cleaning. With lifting, the back side of the spatula is actually touching towards the client's skin. I'm going to turn on my camera and show you the difference. Zoom, help me. There you go. Okay, so let's move that so we can see. In cleaning mode, if this is the skin, I've got the spatula like this at a 45-degree angle. If in lifting mode, cleaning, lifting, cleaning, I like to think about it as pushing product in, space here, see that point, lifting, and then ion plus mode, same as cleaning, ion minus mode, same as lifting. So cleaning and ion plus, lifting and ion minus. So let's read over the ion plus and minus. All right. For the ion plus mode, you're going to use a toner and keep the skin wet or moist. Choose ion plus and hold the metal ion bar on 2 sides. So the 2 sides I showed you. The spatula downwards close to the skin with a 45-degree angle. And then keep your skin moist during the full treatment. Use 2 or 3 times a week, just like the other. Once in a facial treatment. So you can do ion plus for 3 to 5 minutes. You can do cleaning 3 to 5 minutes. You can do lifting 3 to 5 minutes in one treatment. The positive ions will be generated when the instrument is used. The instrument works according to the principle of attraction of opposite ions to remove the grease and age cutin, which is dead skin, from the follicle. And then you have the ion minus mode, which is using a facial essence, a lotion, or a facial mask. And you are going to choose ion minus, which is going to hold the metal bar on the 2 sides as well. And then you're going to have the spatula upward close to the skin with a 45-degree angle. Keep your skin moist during the entire treatment, and then use the frequency 3 to 5 minutes for the ion negative, and then the negative ions will be generated while the instrument's in use. And the instrument, again, works according to the principle of repelling ions. So we're going to make sure that the nutrients refer to negative ions, and the nutrition that is permeated into the deeper layer of the skin is also working to push the product in. So ion negative, ion positive. When in doubt, do both negative and positive. If you don't know the pH of a product, perform the function on negative and positive. If you are familiar with the pH or the product specifies if it is negative or positive, then that's when you're going to make the determination then. But when in doubt, do both functions just like you would with the galvanic. I'm sorry, I lost the word for a moment. So just like in galvanic, when you do anaphoresis and cataphoresis, if you're not sure of the polarity of the product, same with the ion plus and the ion minus. The difference is I wouldn't do 3 to 5 minutes. I would probably do 2 minutes on ion plus, 2 minutes on ion negative. That way I've covered all my bases and the product has been properly permeated into the skin. We are going to take these and add them right to it. Also, be sure to make sure that you are maintaining the instructions for the actual device that you have and not a general rule of thumb, because the device may be set up a little differently. So you want to make sure that you are following the instructions for the device that you have. The instructions that we went over are for the devices that are actually in the facility. If you do get a different type of device, then I would make sure to follow the instructions given to me by that device. There is another device. I'm trying to think of the name of it. It's far more expensive than the skin scrubber, but it also works. I got an opportunity to use it. I did like it. It's not that much different than the skin scrubber. It just has its different set of rules, different set of, the functions are the same. They just call them something different. Oh, BT Micro, that's what it's called. Let's look it up. $316 BT Micro. And the kind that I trained on looked like this. So as opposed to it saying ion plus, ion minus, cleaning, lifting, there says exfoliation, serum, cream, and clear. So same type of device, different manufacturer, different company. It's biotherapeutic. It is, it is nice. I used the BT Micro before, but it's the exact same thing as the skin scrubber. It's just a branded version of it. And it really depends on the type of comfort that you have and how much you want to invest. What I will say that I do like about BT Micro as a whole is you can buy their ampules directly from them, and they're gonna tell you, what it is that you're gonna use it for and what section you're gonna use it with. So instead of having to know the product or using a secondary product line, these ampules are designed to work with their product in each particular function. So that's essentially what that is there. So they have the little ampules and it's branded. So depending on what your goals are for your treatment room, if you know that that's something that you're gonna, do a $45, $65 upgrade to, then it might be worth it to invest in the device with the preset ampules so that I'm using it in a way that's going to be beneficial for the client each and every time. With that being said, do we have any questions about the skin scrubber or ultrasonic as a whole? Perfect.